Today there is such a wide range of mental illnesses that it is impossible to classify them all the same. Some illnesses are less severe than others and more easily treated, while there are some more severe mental illnesses that are not so easily controlled. It is important for psychiatrists to study mental disorders and classify each one differently. By doing this, it makes it a little easier for them to understand and treat a person's specific disorder. Psychiatrists classify mental disorders by a manual called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-IVTR. This manual is a classification system that describes the features used to diagnose each recognized mental disorder and indicates how the disorder can be distinguished from other similar problems. There are 17 categories that are listed on the DSM-IVTR. Number 1 on the list is mental retardation, which is usually detected at birth. Number 4 is substance-related disorders, such as drug and alcohol abuse. Number 5 is schizophrenia. Number 6, mood disorders. And number 7, anxiety disorders. The rest of the list contains somewhat less severe disorders that in most cases are slightly easier to diagnose and treat. The DSM-IVTR takes into account 3 key elements to decide how a person fits into one of the categories. If the person has disturbances in behavior, thoughts, or emotions, the symptoms are associated with significant personal distress or impairment. The person's symptoms stem from an internal dysfunction such as biological, psychological, or both. Psychiatrists will study such behaviors to help decide what mental disorder their patient is suffering from. A few mental disorders that are considered to be the least severe are anxiety disorders such as phobic, panic, obsessive-compulsive, and eating disorders. These disorders are most often classified as the least severe because they do not always require psychiatric attention or medications to cure them. In a lot of cases, if the person admits that they have a disorder and want to take care of it, they are able to control it on their own. Mental disorders considered to be more severe are depression, bipolar disorder, and schizophrenia. These more severe disorders require that the person seeks help to control their disorders. People who have a bipolar disorder or have schizophrenia cannot control the symptoms caused by these disorders on their own. Failure to seek medical attention in these types of situations could potentially end up with the affected individual harming themselves or others around them. According to Ronald Kessler in 2005, it is estimated that about half of Americans will develop some type of mental disorder during the course of their lives. This being said, it is important for psychiatrists to be able to have a good understanding of each different mental disorder so the patient can get the help they need to live their day-to-day lives.